Okay, let's unpack this. If you're a horse owner, how often have you found yourself puzzling over subtle shifts in your horse's mood, maybe their appetite or performance? That unexpected crumpiness, a new reluctance to go forward or just not quite looking right. What if the answer wasn't a training issue or just a bad day, but something deeper, literally, in their gut? Today, we're diving deep into equine gastric ulcer syndrome, or EGUS, a condition that affects a simply staggering number of horses, from the highest level athletes right down to our beloved backyard companions. Our mission with this deep dive, pulling from specialist guides and the latest research, is really to cut through the complexity. We want to give you the core insights and maybe some surprising facts you need to truly understand this incredibly common ailment.
Yeah, and what's truly, I think, revolutionary in our current understanding is that EGUS isn't just one single thing anymore. It's actually two entirely distinct conditions. We now precisely differentiate between equine squamous gastric disease, or ESGD, and equine glandular gastric disease, EGGD. And this isn't just, academic jargon. This distinction is absolutely vital because their origins, their risk factors, and perhaps most crucially, how we treat them differ significantly.
Okay.
Treating them like they're the same problem, well, that often leads to frustration and, frankly, ineffective therapy.
And when we say widespread, we mean truly astonishing numbers, don't we? Imagine 80 to 100% of racehorses in training battling this, or up to 90% of show jumpers.
It's huge.
But it's not just the elite athletes. Even pleasure horses, maybe like the ones in your backyard, are affected at a rate of maybe 25 to 50%. When you hear statistics like that, it really drives home how prevalent this is across the entire equine world, regardless of what you do with your horse.
Absolutely.
So let's begin by defining EGU. Think of it as like an umbrella term, right? For any erosive or ulcerative lesions you find in a horse's stomach. It's the broad category for tummy trouble.
Exactly. And within that umbrella, the updated classification is really key for effective management. First, we have equine squamous gastric disease, ESGD. These are ulcers that form in the non-glandular or the upper portion of the stomach.
Top bit.
Yeah, the top third, including that distinct dividing line called the margo plicatus. Sometimes it even extends up into the esophagus, and this is by far the most common form we see.
Okay.
Then there's equine glandular gastric disease, EGGD. This affects the glandular or the lower two-thirds of the stomach, basically the main acid factory area, and sometimes even the very beginning of the small intestine, the duodenum.
Okay, so to really grasp why these two distinct conditions happen, we probably need to talk about the horse's stomach itself, which in many ways is a bit of a design challenge, isn't it?
It really is.
It's essentially divided into these two very different regions, that upper non-glandular or squamous region and the lower glandular region.
And this is where the critical difference lies. This is where the problem often starts. That non-glandular region, that upper third, it completely lacks protective mechanisms. Think of it almost, unprotected skin.
Right.
It doesn't have a mucus layer. It doesn't have bicarbonate to neutralize acid, and it doesn't have that robust blood flow to help with healing. So it's highly susceptible to acid injury. Now, in stark contrast, the glandular region, the lower two-thirds, does have these sophisticated intrinsic defenses. It's got a robust mucus and bicarbonate barrier, rich blood flow, rapid cell turnover. It's built tough. The margo plicatus, that distinct raised line we mentioned, that's the dividing boundary, and it's often a really common site for ESGD lesions simply because it's where acidic contents splash upwards onto that unprotected squamous lining.
Okay, that makes sense. The splash zone.
Exactly. And this raises a really important question for horse owners. What does this mean for a horse that isn't constantly eating, which is, let's face it, much of the time for many managed horses? Unlike us humans, we only produce stomach acid when we eat. Horses, they continuously secrete hydrochloric acid all day, all night, regardless of feed intake.
Wow, okay.
So their stomach always has acid present, even when it's completely empty.
Right, it's like a continuous acid bath down there. But horses do have some pretty incredible natural buffering mechanisms, right? Designed for their grazing lifestyle.
They do, thankfully. Saliva, for instance, contains bicarbonate. And it's produced primarily during chewing, especially when they're eating forage.
Or chewing more buffer.
Precisely. The more they chew, the more saliva, the more bicarbonate to help buffer that acid. And that forage also creates what we call a fiber mat in the stomach.
A fiber mat.
Yeah, imagine a dense raft of chewed hay just sitting on top of the stomach contents. This can literally create a physical barrier.
Oh, interesting.
Helping to protect that vulnerable squamous mucosa from the acid splashing up.
So we have this unique stomach design, continuous acid, two very different regions. This leads us right to the heart of it. What actually triggers ulcers in such distinct areas? What's the smoking gun for ESGD versus EGGD? Let's unpack the why behind both.
Okay. For ESGD, the primary cause is basically prolonged or excessive exposure of that unprotected squamous mucosa to highly acidic gastric contents. We're talking hydrochloric acid, pepsin, even volatile fatty acids from carbohydrate fermentation sometimes. It's essentially a splash lesion.
Right.
The acid is always there, and if it's not consistently buffered by saliva or protected by that fiber mat, it just washes over that sensitive upper lining, causing erosion and eventually ulcers.
So what increases the risk of that happening?
Well, the key risk factors for ESGD relate directly to this acidic environment. First, feeding practices. Big one. Intermittent forage access or prolonged fasting, letting them go more than about 6 hours between forage meals, significantly increases risk.
Why is that?
Less chewing means less saliva, so less buffering.
Mm.
And an empty stomach means that continuous acid has free rein to bathe the sensitive upper lining.
Makes sense.
Also, high concentrate diets, meaning high starch or sugar, are a major culprit. They lead to less chewing time, so less saliva.
Right.
But also, importantly, they produce volatile fatty acids from that rapid carbohydrate fermentation. And those VFAs are highly damaging to the squamous mucosa, especially in an acidic environment. So, low forage intake, too much grain. Huge red flags for ESGD.
Okay.
Second, exercise. High intensity or prolonged duration work. This leads to increased intra-abdominal pressure.
Squeeze in the stomach.
Exactly. It quite literally pushes acidic contents upwards onto that unprotected squamous mucosa. Combine that with reduced blood flow to the gut during intense exercise, blood's going to the muscles, right?
Yeah.
And you have a recipe for potentially severe ESGD. Stress is another factor. Confinement, travel, changes in routine, training stress, all these can alter gastric motility and blood flow, contributing. And even just water deprivation, by reducing overall fluid intake, can indirectly reduce buffering. Oh, and while it's more strongly linked to EGGD, even NSAID use can contribute sometimes to ESGD through systemic effects that reduce mucosal blood flow.
So it really sounds like a high-performance horse, on a regimented feeding schedule, intense training. They're almost a textbook candidate for ESGD. That's a huge takeaway.
It really is.
But what about the other type of ulcer, the glandular ones, EGPD? How do those develop? Because you said that part of the stomach is actually built to be tough and protected.
It's a great question because it is sort of counterintuitive, isn't it? EGGD is honestly less understood than ESGD precisely because that glandular lining is supposed to be so resilient. The thinking is it results from a breakdown of those intrinsic defense mechanisms, things like the mucus barrier failing or bicarbonate secretion reducing, or the stomach's natural repair processes getting overwhelmed, maybe issues with local blood flow.
So the defenses fail somehow.
Exactly. And what's fascinating here is how distinct the mechanisms often are compared to ESGD.
What are the big risk factors for that type then?
Well, for EGGD, stress might play an even more direct role than in ESGD, potentially impacting the stomach lining's natural defenses through neuroendocrine pathways. A nervous temperament could definitely be a risk factor here.
Okay.
But a crucial risk factor for EGD, a really big one, is the prolonged or high-dose administration of non-steroidal anti-inflammatory drugs, NSAIDs.
Like bute or Banamine.
Exactly. Phenylbutazone or flunixin meglumine. These drugs inhibit crucial protective chemicals called prostaglandins, specifically PGE2. And prostaglandins are absolutely vital for maintaining the stomach lining's blood flow, its mucus production, its bicarbonate secretion.
So taking those away leaves it vulnerable.
Precisely. It predisposes the otherwise protected glandular mucosa to acid injury. It is worth noting that some newer NSAIDs, the COX-2 selective ones, seem less likely to cause this kind of GI damage.
Good to know.
Other factors briefly mentioned in studies include some breed predispositions, warm bloods and Frisians, maybe at higher risk, and bile reflux, where bile splashes back from the small intestine. And it's important to reiterate, Helicobacter pylori, that common cause of ulcers in humans, not proven as a primary cause in horses.
Right. Important distinction. So, okay, we've mapped out what EGUS is, how our understanding has evolved into ESGD and EGTD, and why it happens. Now let's tackle the challenge of spotting it, because honestly, the clinical signs of EGUS are often so vague, aren't they, and nonspecific. And you mentioned many horses can even be asymptomatic with significant ulcers. It's not always obvious. It's not like they're holding up a sign saying, my tummy hurts.
No, it's really not, which is why it can be so frustrating for owners. Common clinical signs, and they often overlap between ESGD and EGGD, include behavioral changes. You might notice your horse is suddenly irritable or sour, maybe girthy, showing pain when you're cinching up the saddle.
Yeah, that's a common one people mention.
Or an unwillingness to be groomed, a reluctance to work, maybe developing new behavioral issues under saddle, like rearing, bucking, spooking, refusing jumps. In the barn, you might see a poor appetite or picky eating, especially refusing grain. Sometimes it's more general, weight loss, poor body condition, or just a dull, unthrifty hair coat. Recurrent mild colic or general signs of abdominal discomfort, also a red flag. Performance-wise, they might lack that drive, seem to lose stamina easily, or just not have their usual sparkle.
Right.
Some horses might develop stereotypes like crib biting, wood chewing, or weaving, though the direct causal link there is complex. And teeth grinding or bruxism, especially in foals or during really painful episodes, is another indicator.
What about diarrhea?
Diarrhea is actually less common with gastric ulcers. It can happen particularly with severe glandular ulcers, but it often points more towards hindgut issues.
Okay. And what about our youngest equines, the foals? Their signs can be a bit different, right? And sometimes, sadly, more dramatic.
Yes, foals show specific signs. They might nurse intermittently, frequently lie down, sometimes on their back, which we call dorsal recumbency.
Oh, what?
Bruxism, the teeth grinding, and tyolism, which is excessive salivation, are also common. You'll often see poor growth or just a generally unthrifty appearance. And in rare, very severe cases, though it's a very serious and usually fatal complication, gastric rupture can occur.
Yikes. Okay, so given how vague the signs can be and how much they overlap with other problems, how do we know? How do we know for sure a horse has ulcers? And more importantly, which type, ESGD or EGGD? What's the definitive way to get a diagnosis, not just, a guess?
Right. The gold standard, the definitive diagnostic method, is gastroscopy, also known as esophagogastroduodenoscopy, a bit of a mouthful.
Yeah.
This procedure lets your vet directly see the entire lining of the stomach and the very beginning of the small intestine. A flexible, long endoscope, about 2 to 3 meters, is gently passed through the nose, down the esophagus, and into the stomach. The horse is sedated, of course, for comfort, and it's absolutely crucial that they're fasted. We're talking at least 12 to 16 hours for feed, and maybe 2 to 4 hours for water.
Why so long?
It ensures the stomach is completely empty, otherwise you just can't see the lining properly through all the food and fluid. Need a clear view.
Gotcha. And what are the benefits of doing that scope?
Oh, the benefits are huge. It doesn't just confirm a diagnosis, it also clearly differentiates between ESGD and EGGD, which, as we've said, is paramount for guiding the right treatment.
Right, because the treatments differ.
Exactly. We can quantify the severity of ESGD using a standardized 0 to 4 grading system. For EGGD, we describe the lesions by their location and appearance. This lets us assess multiple lesions, see how bad they are, and importantly, rule out other gastric issues like tumors or impactions, things like that. If we connect this back to the bigger picture, it's really the only way to get a precise diagnosis and know exactly what you're treating. And for EGGD, that isn't responding well to therapy. We can even take gastric biopsies during the scope to look for other inflammatory conditions or maybe specific bacterial involvement.
Okay, so it's clearly the best diagnostic tool. But it does have some practical considerations, doesn't it? I mean, it's invasive, it requires specialized, expensive equipment, and you mentioned that long fasting period, while necessary, can actually sometimes induce new, low-grade squamous lesions in some horses. That seems counterproductive.
It can slightly complicate the picture sometimes, yes. It's usually minor, but it's a consideration.
So what about an alternative? Perhaps when gastroscopy isn't immediately feasible, maybe for cost reasons or availability?
In those situations, we sometimes consider what's called an empirical treatment trial.
Okay, what's that?
The idea is basically to administer anti-ulcer medication, typically omeprazole, for a set period, and then just observe if the horse's clinical signs improve.
Sounds reasonable.
Well, it has significant limitations that owners really need to understand. If the signs improve, great. It certainly supports a diagnosis of EGUS, but it doesn't differentiate ESGD from EGGD. You still don't know which type you're dealing with. And critically, it doesn't confirm whether the ulcers have actually healed. maybe they just feel a bit better.
Ah, okay.
And if the signs don't improve, it could mean the diagnosis was wrong all along. Or maybe the treatment is ineffective for that specific type of ulcer, like using omeprazole alone for tricky EGGD. Or perhaps there are compliance issues, the horse isn't getting the meds properly.
Lots of variables.
Exactly. This is why gastroscopy is strongly recommended if a horse fails to respond to an empirical treatment trial. It's the only way to truly know what's going on in there.
And what about other diagnostic aids we sometimes hear about, like blood tests or fecal tests? Are they helpful?
Not really for a specific diagnosis. Fecal occult blood tests, for example, can indicate GI bleeding anywhere in the tract foregut or hindgut, but they're not specific for gastric ulcers or their severity.
Okay.
Blood work, generally nonspecific. The results are usually normal unless there's very severe systemic inflammation or maybe a significant hemorrhage, which is rare. And symptom scores or questionnaires where you track changes in your horse's behavior or appetite, they can be useful for monitoring response to treatment, sure, but they're definitely not diagnostic tools on their own.
Right, so scope is really the way to go for diagnosis.
Yeah.
Okay, so let's say we have a definitive diagnosis. What's the game plan? How do we get these horses comfortable and healed? And maybe most importantly for many owners, how do we prevent this incredibly common and, let's be honest, frustrating problem from just coming right back?
Yeah, prevention is key. The approach is really dual. We use pharmacological treatment drugs to reduce acid exposure and protect the mucosa. And this must be combined with crucial management and dietary changes. You can't just rely on the meds.
Okay, let's start with the drugs then.
Okay. The gold standard for acid suppression is a class of drugs called proton pump inhibitors, or PPIs. Omeprazole is the most common one used in horses. They work by irreversibly blocking the little pumps in the stomach wall that secrete acid. This makes them the most potent acid suppressants we have.
And owners probably know the brand names.
Right. For horse owners, you'll typically encounter the FDA-approved paste products like Gastrogard for treatment and UlcerGard, which is a lower dose for prevention.
Okay, now this raises a question I hear a lot. What about compounded omeprazole? It often seems like a cheaper option.
That's a really important point. While compounded versions might seem less expensive up front, their use is generally discouraged
Why is that?
because of inconsistent efficacy. Studies have shown wide variations in the actual amount of active drug, its stability, and its absorption compared to the approved products. So you might think you're treating, but you might not be getting the correct dose into the horse, or the medication might break down before it's absorbed properly. It makes treatment potentially ineffective. It's a real risk.
Okay, stick with the approved stuff if possible. So how is omeprazole used for the different types?
For ESGD, the squamous ulcers, omeprazole at the treatment dose, typically 4 milligrams per kilogram, once a day, orally for about 28 days, is indeed the gold standard. Healing rates are often really high, like 70 to 90%. It's incredibly effective for ESGD.
Great, but what about EGGD?
EGGD is tougher. Omeprazole alone has much lower healing rates for glandular ulcers, sometimes only 14 to 25% in studies.
Wow, that's low.
It is. This means EGGD often requires longer treatment durations, maybe 6 to 8 weeks or even longer. And frequently, it needs combination therapy, adding other medications alongside the omeprazole.
And how should you give it? Does timing matter?
Yes, omeprazole is generally best given on an empty stomach, maybe 30-60 minutes before feeding. This helps with optimal absorption. And for horses that have been on it long term, tapering the dose gradually when discontinuing is often advised. This can help prevent a temporary increase in acid production, sometimes called rebound acid hypersecretion.
Okay. Are there other drugs we should know about? You mentioned combination therapy.
Yes, we also have H2 receptor antagonists like ranitidine or famotidine. They also reduce acid, but they're less potent and shorter acting than omeprazole. They might be used as adjuncts sometimes, or perhaps for prevention in specific cases.
Right. And what about mucosal protectants? I think sucralfate is one.
Exactly. Sucralfate is quite clever. It forms a viscous, sticky gel that binds specifically to ulcerated tissue. It basically creates a physical barrier over the ulcer, protecting it from acid and pepsin.
So like a Band-Aid for the ulcer.
Kind of, yeah. What's crucial to understand about sucralfate, though, is its primary indication. It's particularly useful for EGGD, the glandular ulcers, though it can also be an adjunct for severe ESGD.
And how do you give that one?
Like omeprazole, it needs to be given on an empty stomach. And importantly, at least 2 hours apart from omeprazole or other oral medications, because it can actually impair their absorption if given too close together.
Okay, good tip. Any other major players?
Yes, particularly for EGGD, there are prostaglandin analogs, most notably misoprostol. This medication can be highly effective for EGGD, especially ulcers caused by NSAI use.
How does it work?
It works differently. It enhances the stomach's natural defenses, boosting mucosal blood flow, increasing mucus and bicarbonate secretion, and it also inhibits acid secretion a bit.
Sounds great for EGGD. Any downsides?
Yes, a crucial warning for owners. Misoprostol can cause signs of colic abdominal pain, diarrhea, sweating because it affects smooth muscle contraction. And critically, it must be avoided in pregnant mares because it can cause abortion. Very important.
Definitely noted. Anything else? Antacids?
Yeah.
Antibiotics?
Antacids, like Tums for people, they directly neutralize acid, but their effect is extremely short-lived in horses, maybe an hour or two. So they're really impractical for routine treatment. And antibiotics are rarely used unless a specific bacterial involvement beyond just normal stomach flora is confirmed by a gastric biopsy. That's not common.
Okay, so we've covered the main medications, but you said earlier, and many owners feel this way, that medication alone isn't the silver bullet. How crucial are those day-to-day management changes, really? Are they just supportive, or are they truly foundational for healing and preventing this from just coming back again and again?
They are absolutely critical. Foundational is the right word for both healing and prevention. And they must be implemented alongside medication for any chance of lasting success. You can't medicate your way out of bad management, basically.
Okay, so what are the top management changes?
First and foremost, maximize forage intake. Provide constant access to hay or pasture, ideally ad libitum free choice.
All the time.
As much as possible. This encourages continuous chewing, which means continuous saliva production for buffering that acid. And it helps maintain that protective fiber mat in the stomach. Slow feeders can be incredibly helpful here to extend consumption time, mimic grazing.
What about type of hay? Does it matter?
Alfalfa hay is often particularly beneficial. It has higher calcium and protein content, which gives it greater buffering capacity compared to most grass hays. Doesn't mean grass hay is bad, but alfalfa can offer extra buffering.
Good to know. What's next?
Second, minimize concentrate feed, especially high starch sugar grains. If your horse needs additional calories beyond forage, opt for low starch, high fiber, high fat alternatives. Think beet pulp, specialized feeds, and always divide any concentrate meals into multiple small portions throughout the day. Avoid dumping large amounts of grain into the stomach at once.
Okay.
And of course, goes without saying, always ensure constant access to fresh, clean water. Hydration is key.
Makes sense. What about stress? That came up earlier.
Huge factor. Reduce stress wherever possible. Maximize turnout time, ideally with compatible companions, allowing natural grazing and social interaction. Maintain a consistent daily routine for feeding, turnout, and exercise. Horses thrive on routine. For horses in demanding environments or during known stressful periods like travel or competition, consider using preventative doses of omeprazole, like UlcerGuard, under vet guidance.
Right.
And providing environmental enrichment in stalls' hay nets, toys can also significantly help reduce boredom and stress behaviors.
What about exercise itself? Any tips there?
Yes, exercise modification is another key practical tip. Feed a small amount of forage, maybe 2 to 4 pounds of hay or alfalfa, about 30 minutes before exercise.
Right before.
This creates that fiber mat and helps buffer the acid splash that happens during exercise. Essentially puts a protective barrier between the acid and the sensitive upper stomach lining. Critically, never exercise horses on a completely empty stomach.
Okay.
And implement extended walk cool downs after work. This allows the gastric contents to settle and reduces that post-exercise acid splash.
Good practical advice. And the NSAIDs.
Use NSAIDs judiciously, only when absolutely necessary, at the lowest effective dose, for the shortest possible duration, and always under veterinary guidance. If long-term NSAID use is truly unavoidable for a chronic condition, then definitely discuss concurrent prophylactic medication like omeprazole or perhaps sucralfate-misoprostol with your vet to protect the stomach.
Okay, so a lot goes into the management side. It's not just popping a pill.
Not at all. It's a whole horse approach.
So once we've made these changes, what's the long-term outlook for a horse with EGUS? And how do we really prevent this from coming back? Because for many owners, it feels like a constant battle.
Yeah, recurrence is definitely a major concern. For ESGD, the squamous ulcers, the prognosis is generally very good to excellent if treatment is appropriate, and those management changes are consistently maintained. Healing rates with omeprazole are high. However, EGGD, the glandular ulcers, is more challenging. It often requires those longer treatment durations, combination therapy. So the prognosis for complete lasting healing is honestly more guarded. What's absolutely crucial for owners to understand is the high risk of recurrence, especially in performance horses. If those underlying risk factors, the feeding, the stress, the exercise intensity, aren't adequately addressed and managed long term after the initial treatment course finishes.
So the management changes aren't temporary.
Often, no. They need to become the new normal, especially for susceptible horses.
That means monitoring is key then, right? How do we know if our efforts are working or if the problem is creeping back?
Absolutely. Constant observation is vital. You need to continuously monitor for improvement or any recurrence of those subtle clinical signs. Keep a close eye on changes in appetite, behavior, attitude, performance.
And scoping again.
Yes, repeat gastroscopy is highly recommended. It's the only way to truly confirm ulcer healing, particularly for EGGD, and it helps guide when it's appropriate to discontinue medication.
When would you typically reoscope?
Typically, maybe 4 weeks after starting treatment for ESGD, and perhaps 6 to 8 weeks, sometimes longer, for EGGD, depending on the severity and treatment plan. This follow-up scope helps ensure that the ulcers are truly healed and you're not just masking the symptoms with medication. Ultimately, lifelong management changes are often necessary, particularly for performance horses. And clear client education from vets on the chronic nature of this condition, its high recurrence risk, and the absolute importance of sticking to strict management protocols is paramount for long-term success.
Okay, so what does this all mean for you listening as a horse owner? We've covered a lot today. We've learned that EGUS isn't just one condition, but two distinct ones, ESGD and EGGD, each with different causes and, crucially, different treatment approaches. Gastroscopy is the gold standard for getting a definitive diagnosis, giving you that clarity. Omeprazole is the cornerstone for treating ESGD, but EGGD is often more complex, frequently needing combination therapy. And most critically, perhaps, aggressive management changes, especially around feeding, forage access, and stress reduction, are absolutely vital, not optional, vital for both healing and preventing recurrence. Being this well-informed helps you be a much better advocate for your horse's health, doesn't it? It helps translate those vague worries into potentially targeted action.
Absolutely. There may be a final thought. Given the remarkably high prevalence of EGUS across all types of horses, from racehorses to pasture pets, and the fact that their stomachs continuously secrete acid, unlike ours, perhaps we should start viewing gastric health not just as a problem to be solved when signs appear, but more as an ongoing proactive management consideration, much like we think about routine hoof care or dental health. Especially for horses living in more demanding modern environments, it's about proactive prevention, not just reactive treatment.
That's a great point. So maybe take a moment to reflect on your own horse's routine. Could these insights prompt some small but potentially impactful changes? Think about their daily forage availability, their stress levels, how you manage their feeding around exercise. Sometimes the smallest shifts can really have the biggest impact on their gastric health and overall well-being.